What's going around? Sponsored by SN Healthcare. Your health is essential.
Welcome back at 9:24 in this morning's What's Going Around segment. April is Autism Awareness Month, and Pix 11 is speaking today to a pediatric neurologist, Dr. Theodora Andriotis from Northwell's Lenox Hill Hospital, about red flags and effective treatment. Thank you so much for being here. Doctor, tell us what causes autism, and can you give us an overview of the different stages of the developmental disorder?
Sure. So we're not 100% sure exactly what causes autism. Our understanding of what causes it right now is a combination of genetic factors and some kind of interaction with the environment that's maybe turns on certain genes and affects the way that the brain develops and the connections that it forms. We don't have necessarily stages of autism, but we do try to classify autism into different levels. So based on how much support that individual needs. So level 1 means minimal support, level 2 needing moderate support, and level 3 needing substantial support.
As a parent of a toddler, this is certainly something I think about quite a bit. So when can doctors diagnose autism, and does it progress with age?
So doctors can diagnose autism as early as a year, though the average age of diagnosis in America is actually at 5 years old. The symptoms present much earlier, so in infancy and toddlerhood. The progression with age is variable, right? So of course, with early interventions, the severity of the symptoms can change dramatically.
Yeah, and I know there's all kinds of treatments out there. What are red flags that could indicate autism?
So things that parents should look out for is when the child does not consistently respond to their name, if they're not pointing and demonstrating other gestures that you would expect around that age. So waving, blowing kisses. Some children might not have a lot of verbal words. So instead of, being able to communicate their needs, they might cry a lot and get upset very easily, very frustrated. And then sometimes severe picky eating can also be a sign of autism, along with other sensory sensitivities.
And we have mentioned, can you provide some examples of some of the effective therapies for autism?
So the therapies that we have right now are behavioral interventions. So ABA therapy is applied behavioral analysis. There are other similar forms like DIR, or floor time, where the therapist works directly with the child and tries to modify their behavior. And then, of course, speech therapy is focused on helping with the language skills. Occupational therapy helps with fine motor skills, so being able to pick things up, feeding themselves, also a lot with the sensory sensitivities that they might have. And then some children with autism might toe walk, so physical therapy can help there, especially if their ankles are getting tight.
Excellent. Dr. Andriotis, thank you so much for stopping by. Vanessa and Dan, I'm going to send things back over to you.
All right.